I'm really excited to show you this week's video. I've teamed up with Public Health England and we timed it to be released on European Immunisation Week. Our goal for this video is to help explain to everyone the importance of the shingles vaccine and hopefully increase its uptake amongst the elderly. Because as we age, we're at higher risk of getting shingles, and after the age of 70, we're at even higher risk of serious complications. So without further ado, let's begin the video. Shingles is an interesting one. It's caused by a virus called varicella zoster or herpes zoster, but you don't actually catch it. So, varicella zoster is the virus that gives us chickenpox, and when we recover from it, it lives in the nerve roots next to the spine. At this point, it's dormant, so it's symptomless and you don't know you have it. Now, many years later, without any exposure to the virus, it can suddenly become active and cause the symptoms of shingles. So you can't quite catch shingles, but if you have shingles, you can give someone chickenpox who's never been exposed to the virus. And I hope that made sense.
Makes perfect sense to me.
Shingles normally affects one side of the body, and it stops dead in the middle. It's usually around your chest, tummy, or upper face. It often starts with feeling generally unwell or having pain for 2 to 3 days. You then get a red rash, followed by blisters, which scab over after about 2 to 3 weeks. The pain usually lasts about 2 to 4 weeks, but some people get really nasty nerve pain, which we call post-hepatic neuralgia, or PHN for short. And PHN affects 1 in 5 people who are over 60, and this pain can last for months or even years after the rash has completely disappeared. There are other complications associated with shingles, so it can cause skin infections, it can cause inflammation of the front of the eye, which can cause a loss of vision, and it can also cause weakness of the muscle, which is supplied by the affected nerve. If there's one thing that pharmacists love more than medicines, it's scientific studies. And the data on the shingles vaccine is actually really good. So I'm going to give you a quick breakdown and I'm going to write it down for more impact. But bear with me. Okay, so since the vaccine was introduced in 2013, it's estimated that it was 62% effective against shingles and also between 70 to 88% effective against PHN. Now that's amazing because PHN is probably the most common thing I hear patients complain about who have had shingles. And here's my last fact, which I won't bother writing down. Between 2013 to 2016, GP visits for shingles and PHN fell by 35 to 55% respectively in those aged 70 years old. The good news is that the shingles vaccine has a very good safety record, and it only actually needs to be done once at any time of the year. Now, if you're 70 or 78 years old, then you're eligible for the free NHS shingles vaccine. But if you missed it and you're under 80, then fear not, because you may still be able to have it done. Please pause the video on this chart, which shows who is eligible for the free NHS shingles vaccine between the 1st of April 2018 to the 31st of March 2019. But despite such positive results, the uptake of the vaccine has actually reduced. Since the start of the programme, the uptake has reduced by 13% in those aged 70 years and by 8.4% in those aged 78 years since 2014. And the final bit of bad news is that over 50,000 cases of shingles happen in England and Wales each year in those aged 70 and above. And approximately 50 cases are fatal. I encourage everyone who's eligible to contact their GP practice and get the shingles vaccine whilst you can, because it's the best way to avoid the disease and avoid long-term complications that can develop from it. And if you have any friends or family who are 70 or over, then please help spread the word. Share this video to them, show them this video, or even inform them about this video so they can hopefully get vaccinated. And if you want more information, then please read the description below. Our population is aging, and as we get older, the risk of getting shingles and complications increase. So immunisation is the best way to protect yourself. And remember the World Health Organization slogan, prevent, protect, immunise. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.